So, you know, we were talking about the fact that only 6% of patients with pancreatic cancer enter on a clinical trial, and why is that? I think it's a number of issues, but they're really important ones to highlight. One is there's a little bit of a nihilistic approach out in the community that says, oh, you have pancreatic cancer, you know, there's nothing that can be done, and I think that's wrong. I think there are things that can be done. There are a lot of people testing innovative new therapies, and it's important for us as a community to work together to make sure that we give patients those options to get new therapies that can be beneficial. Two is this is the kind of disease that you really should seek a team of experts for your care. This is a complicated disease. Here you see a panel of 5 different experts in different areas. There's a lot of information that needs to come into play to figure out how to treat someone's pancreatic cancer most effectively. And so for patients that have the ability, you know, we really should try to get patients to centers where clinical trials are available so that we can work together to make advances in this disease.
And we don't always necessarily have a patient get all of their care here. We can even offer an opinion. We have patients travel hundreds of miles to come here to be seen, to be evaluated, and get a recommendation at the very least. And I think patients benefit from that.
I totally agree. We are happy to coordinate care with physicians out in the community, but I think, you know, that initial evaluation and getting an understanding of what the state-of-the-art care is in the disease is really important.
And what options are available.
And then, the other thing it's important for patients to realize is it's okay to get a second opinion. No physician should ever feel bad if their patient says, I really like to get a second opinion from a team of experts. And then a follow-up point is there are multiple times along the course of treatment where there's a pause and a decision that's being made. Is what I'm getting treated with working or not? And if it's not doing what it needs to do, then that's a time to consider all options again. And so, you know, we try to consider our program as a resource to people so that they can help sort through these difficult issues.
One of the things that I'm really proud of for our program, and I guess this is the time I want to kind of bring it up, is that we appreciate that patients are dealing with a cancer diagnosis and that they're scared and that time is really of the essence for them. And we have a really good record of getting patients in quickly and getting them seen. And so I think at least at our center, when we're contacted by referring doctors that want a second opinion in this situation, we do a really good job of getting people here quickly.
Yep, I think that's true.